Hi, I'm Dr. John Heary, and for nearly 2 decades, the topic of cholesterol is rarely discussed, and now cholesterol is a scapegoat for nearly every case, dealing with heart disease. Where do you see it? It's plastered on billboards, right? Commercials. It's on signs in your doctor's offices. Each display piece is, trying to persuade you for the need of medications to lower cholesterol, listing, the consequences if your cholesterol does go too high. But what if cholesterol, was really just your body's attempt to heal and repair? Cholesterol is needed for, fat digestion, the utilization of vitamin D, hormone production, and repair and growth of every cell in the body. The notion that, cholesterol is the cause of heart disease, it's very much ingrained in most people's minds. Fortunately, it's a myth, that is slowly, being put to rest. Cholesterol is a vital component of every single cell membrane on Earth. Lowering cholesterol, too much can actually increase your mortality risk. People with low cholesterol, they really don't fight off infections as readily. Cholesterol is also a precursor, to all the steroid hormones. You can't make estrogen, you can't make testosterone, cortisone, and a whole host of other, vital hormones can't be made in your body without cholesterol, or if your cholesterol is too low. Um, Another question you need to ask yourself, especially, if you have arthritis, for those with inflammatory diseases, cholesterol is necessary to heal those damaged tissues. So you want to remember that, cholesterol is a vital component of every cell membrane. So you can't repair or make new healthy cells without it. When someone's in a healing phase, or if there's toxic elements and an infection to deal with, the cholesterol is going to go higher, and that's a normal response to healing. So, in short, we're not so worried about cholesterol, but really, what we want is we want to make sure that we investigate why the cholesterol is high. Okay. So, what can high and low cholesterol do to the body? So, when we look at high cholesterol, okay, it's associated with longevity among the elderly. All right. Higher cholesterol also helps, protect the body against infections, and it also reduces the risk of death from heart failure and also heart attacks, and it protects the heart from stress, protects it from injury. Um, when your cholesterol is too low, you're at a greater risk for infection. You're at greater risk for diseases. It's linked to malabsorption, malnutrition. You can't have good vitamin D production when your cholesterol is low. It's going to reduce the metabolism of fat soluble vitamins, and those include vitamins A, D, E, and K. The American Heart Association has bad and good classifications, parts of the cholesterol. You've all heard like LDL cholesterol. That's typically going to be classified. That's the bad cholesterol, because it's thought to contribute to the plaque in arteries. So, plaque is a thick and a hard deposit that can clog arteries and make them less flexible. Then the other side of it, you have the HDL, which is considered to be the good type of cholesterol. That's the high density lipoprotein. It's important for the synthesis of steroid hormones, and that transports cholesterol away from the arteries and back to the liver for excretion or to reutilize it. So, first we must address that there's no such thing as good or bad cholesterol. All right. So, cholesterol is just cholesterol. HDL and LDL, those are lipoproteins. What that means is that they're fats combined with proteins. Okay. So what that means is that you have these lipoproteins, okay? They combine with other fats and proteins to be carried through the bloodstream. All right. So since fats, they have a hard time traveling through your bloodstream. So proteins are attached to them, and that helps to carry them or helps shuttle the fat into the tissues or the cells that make the cholesterol. The most, it's, and again, it's the most vital component of every cell membrane on this earth. So by lowering the cholesterol, the body doesn't have that tool to shuttle fat into tissues or repair the cell membranes. Okay. So cholesterol has the ability to spike if there's a need for healing or repairing of the body's tissues. All right, instead of relying on the medication group, which I'm sure you guys have heard of, called statins, right? The statin drugs. So instead of relying on the statins to help regulate your cholesterol levels, why not figure out why your cholesterol is high? Okay, what's your body telling you? All right, so as stated earlier, cholesterol is typically high because the body's trying to heal something, right? So why not support that process? And by supporting the process, that's going to result in normalizing cholesterol levels when the cholesterol has done its job. So here's a few things you want to consider when supporting healing, repairing, and optimizing cholesterol levels. So you want to make sure that you take a high quality animal-based omega-3 fat. All right, one of the most common ones, it's going to be also known as fish oil, right? You want to make sure that you reduce your grains and reduce the sugars in your daily diet, okay? Other things you want to do, you want to add in more vegetables and healthy fats. You do want to make sure you monitor your vitamin D levels, all right? Vitamin D levels on your blood test or on your lab work should be between 50 and 90 nanograms per milliliter, all right? Want to make sure that you do exercise daily. You want to avoid smoking or drinking alcohol. All right, and another one I do recommend, it's a good insurance policy, is to just take a good whole food multiple vitamin. You want to consume ginger, turmeric, vitamin C. They help to reduce inflammation. Okay, or you can also get those things in natural foods as well too, and add those to your diet. So what else can you do to truly monitor your heart health? Okay. You want to make sure that you have a comprehensive blood test done. All right. It's important that the blood tests, include the following tests, which can give you a good picture of your overall heart health and tendency towards disease. So get your the normal blood tests that you regularly get, but above and beyond that, you really should get your C-reactive protein, high sensitivity. Make sure you get that checked. Your creatine kinase is another one you should get checked. Your complete cholesterol panel, including your HDL, LDL, VLDL, total cholesterol. You want to get your triglycerides checked, right? Your hemoglobin A1C, fasting blood glucose, platelets. Those are normal ones you definitely want to get checked. There's also what's called a BNP, B-type natriuretic peptide. That's a blood test that checks for a substance that's secreted by your heart in response to excessive stretching or stretching of the heart muscle in your ventricles. All right. If there's an elevated BNP, it might indicate that there's a heart problem. Okay. And it could be, something like congestive heart failure. So it's a great test to check for cardiovascular risk. So in my office, you know, it's not my job, to get take you off medications. My job is to get your body healthy enough so you no longer need the medication. One can only do this, with proper testing and monitoring, and by completing, a comprehensive blood panel, we're able to determine your starting point and exactly what changes, need to be made, and then retesting to document progress. So by optimizing the body's foundation with the correct supplements and dietary guidelines specifically designed for you based on your testing results, you can see drastic changes in just a few weeks. And remember, prevention is key. So even if you feel like you don't have heart disease symptoms, it's never too early to start monitoring. So, set up your consultation to get started on your healthier lifestyle. All right, I'll talk to you guys soon. Take care now.